I'm Falk Spendeke from the University in Munich. My background is in operative dentistry, periodontology, and over the last 7, 8, 9 years, particularly in AI in dentistry. I'm chairing a number of initiatives on AI at the WHO and their initiative AI for Health, but also the World Dental Federation, FDI, and various standards organizations where we try to make AI safer and more reliable in dentistry.
And I'm Maxime Ducret from Lyon University, so I'm professor in prosthetic and digital dentistry. And I'm also working on many topics, but more specifically about AI and ethics. It means all the challenge related to the use of AI and in the field of dentistry. And I will try to share how much we try to assess, evaluate, and communicate about this challenge in the field of dentistry, because most of the time people are not aware about that.
Yeah, and I would suggest that we start, and we have organized this as follow. I will briefly introduce AI in dentistry, and then Maxime will lay out the problem of sustainability and technology and AI in dentistry, but also beyond dentistry. And at the end, we will come back to a recent publication which we published on this topic and lay out how possibly addressing various things like different stakeholders, technologies, and contexts, we could increase the sustainability of AI in dentistry and eventually solve some of the problems we're having by using AI. So please move to the next slide. I bring here a very brief definition. I usually do that when I talk about AI, which is an incredibly broad definition. AI is everything where we automate intellectual tasks of humans. That could be walking around without hitting the wall, so not like the usual lawn mowing robot, but in a more intelligent way, or interacting and conversing like we are doing this now, talking, understanding each other, or even thinking about things, predicting things, simulating things. So it's really a very, very broad field. And the idea to build these machines, next slide please, is not fully new. You can see this on the left-hand side in that timeline, that the first attempts to build machines which mimic some functions of our human brain have been built 80 years ago. The artificial neuron, a unit which is able to take up information, digest it, and then pass it on to the next neuron, is 80 years old. And also the idea to build neural networks similar to our neurocortex, where these different neurons are patched together in networks and they can display and model complex information, that is now nearly 70 years old. And people were very, very excited about this for nearly 4 decades, and they always failed. That's the interesting story about AI. Until maybe 15 to 20 years ago, they usually failed. You can see this, what we now term AI winters. That is a long period where people had invested a lot and it never worked. And that has a reason. And the reason is, A, we didn't have the right computers. You can see this on the right-hand side. So we only had computers which didn't have the compute we have now. You all knew that NVIDIA has been the most valuable company last year on this planet. They produced graphic cards for AI. And these graphic cards are by now as big as a big piece of luggage, 35 kilos, and they're really powerful. Second, we didn't have enough data. Humankind produces as much data every day now as we did under 2008. If you think about this, that's crazy. 2008, we already had the first smartphones, we had computers, we had the internet. It wasn't like we lived in the stone caves. And nevertheless, we produce as much data now on social media and on the internet every day as we did under 2008. And the third thing, and that is something I display here on the right-hand side, we used a different approach to building AI. We used what we call a rules-based approach, where people program the rules and the computer follows these rules. And the best example I can give you is radiology diagnostics, where we had decision trees in the 90s. And if you had a lesion on a radiograph, you walk through that decision tree. Is it in the bone or outside of the bone? Is it at the tooth or not at the tooth, at the tip or not at the tip? And is it round and translucent or not? And at the end, it was a diagnosis like, this is a radiculous cyst. That has worked out. And I usually ask the audience at this point, please provide me with 3 rules now to distinguish cats from dogs on an image. And if you think about that, that's a hard task. Cats and dogs, they have 4 legs, they have fur, they have a tail, they have eyes and ears. So That's not easy, and that's why people usually struggle, because these rules-based systems, they fail when it gets complex. A dental radiograph might still be okay, but the real world, images, video, speech, that's tricky. Next slide, please. So the whole thing only worked since about 2000, 2010, where we had new mechanisms to build AI, deep learning and machine learning. I will cover this in a second. We had an exponential growth in digital data, and we had the compute power, which we have now. Next slide, please. And the milestones are all there. You know this guy, maybe he was the grandmaster in the Chinese game Go. And this game was always considered to be too complex to teach it to a computer. And as you can see, this guy, he looks a bit fuzzled because he was just beaten by AlphaGo, which was a computer system by Google using AI. And by now, these systems are so powerful, next slide, please, that you all have heard about the different applications, and I will cover one or two of them in a second. Behind these big successes are these huge neural networks, and I just want to give you one small example. The previous version of ChatGPT, ChatGPT-4, had around 1 trillion neurons, 1 trillion units, you could say. Our human brain has 85 billion neurons, so if you want to compare it, which is not fair because you can't, you could say ChatGPT had 10 times more neurons than our brain. That's, as I said, not really true, because ChatGPT has far less connections between these neurons than our human brain. And talking about sustainability, our human brain runs on 20 watt, which is an energy-saving light bulb, and that's something ChatGPT will not be able to do. Next slide, please. If we look at the convergence of this whole thing, AI, hardware, developments in the field, we are at an era where really astonishing things happen. You all use ChatGPT, you get a feeling how powerful these large language models are. But at the end, if you merge this with further technological advancements, you get something like this here. This is a robot, a drilling robot essentially, which drills cavities for crowns and for fillings in 2 minutes, fully autonomously, based on an intraoral scan and optical coherence tomography, which this robot also autonomously takes. And nobody has to basically intervene. No human is intervening. I have a small video in the next slide, please. And please click on the video where you can see what the robot is doing. The robot is now prepping this tooth here. It is fixed with this black thing at the dental arch. Someone has to take away the lip regularly, and then it just does the crown prep. Now it does the occlusal reduction. I'm not a prosthodontist, but I wouldn't do it that way, and probably Maxime wouldn't do it that way either. But this is possibly the future, with lots of impacts on affordability, on sustainability, but also on human autonomy. Is this useful? Are these technologies already there in a way that we can say, well, they are clinically and also from a global health perspective useful? The answer is clearly yes. This was the first study in the field of caries detection using AI, where we built an AI system, which we eventually also marketed, which detected caries on radiographs, and we compared its performance with 7 dentists. You can see the dentists here as these pink dots, and we compared sensitivity, so how many caries lesions do we find, and specificity, how often do we think it's caries and it's not. And just for your orientation, we want to be in the upper left corner. And you can see that the dentists there, at least, well, they're not in the upper left corner, but they're in the left corner. And if you look at their mean accuracy values, that's this cross you can see there. We dentists, we have one thing where we are good at, that's specificity. Specificity is 90% or more. So if we really find caries, it's there. We don't hallucinate, but we have a sensitivity of 50% or less. We miss every second caries lesion on an image. And that's something which we find across the field. And if we compare this with the AI, that's the blue dot here, we can clearly see that there is something going on. The AI has doubled the sensitivity with nearly the same specificity. And that's the same for apical lesion detection, periodontal bone loss, and also regardless if it's radiographs or if it's photographs or if it's scans, these systems are good. They are really good, and we've learned that by hundreds of studies showcasing that we can build AI with at least human or even superhuman accuracy. Next slide, please. If we go into some detail here, you can even see why, in this case, the AI was better than the humans. The humans, D1, dentist 1 to D7, they were okay in detecting these advanced caries lesions. The red bars are not our problem. Our problem are the yellow bars. That's detecting the early caries lesions. And dentists do D2, 3, 4, 6, 7, they were really, really poor at that. They had problems at finding the early enamel lesion, whilst the AI model, the two left bars, it didn't care because these systems are analyzing imagery, but also speech and so on very differently and very efficiently in comparison to humans. Next slide, please. In the long run, what we want to build is AI which goes beyond what I just presented in these first 10 minutes. We want to build AI which uses different sensors like a modern car. We call this sensor fusion or multimodal AI. And we are seeing a glimpse of this on the horizon if we're looking at modern scanners and scanner manufacturers. And you can see an example here on the right-hand side where you basically have a 3D point cloud, you have photos patched over that point cloud, you have near imagery, and stepwise, we also get all of this done and analyzed by AI in something which resembles a little bit this approach of multimodality. Next slide. The goal of this at the end is to come to what we call a precision medicine or P4 dentistry, a precise, personalized, preventive, and participatory medicine, P4 medicine, where we use omics data, maybe social media data, e-health records data, and digital tools to overcome the one-size-fits-all approach of the past and also the stratification approach into low risk and high risk, which we're using now. We are not there yet, and we can't go into much more detail due to time reasons, but I think I gave you some options and some chance to see what is happening out there. And now Maxime will concentrate on the aspects of sustainability.
Thank you, Falk. So after this short introduction, the idea is, okay, we are pretty lucky to work in this time. We're gonna have more and more technology, more and more device, hardware, software, but what about the sustainability of all these things in a period of yeah, there is something. Nobody know if it's good or not. We try to improve performance. We try to improve the management of patient, but yeah, it costs a lot economically and environmentally. So here the question that we want to discuss is it sustainable? And when we try to look about the challenge related to the implementation of AI in the field of dentistry, you can have here a couple of examples of articles, and each of these articles say, okay, there is a lot of opportunity, but there is also ethical question, challenge associated to the implementation of AI. So we need to be aware about all these challenges, and sustainability is one of the key challenges related to the implementation of AI. So initially, I start to work on this question like 6 years ago when I was in Montreal, because Montreal is one of the most advanced places in the world regarding to the challenge related to the implementation of AI. And we started with a scoping review just to mapping what is going on in the field of dentistry. And what we looked is there is a mix of different things, user, task, and context. And it will be a starting point for the last part of this presentation. But what we saw is all the specialty in our field are impacted and will be impacted by AI. But the most important one, it's exactly the same that in medicine, it's radiology. There is so many AI tools in radiology, and we need to look about what is going on in radiology because they have more experience about that, and it will probably help to see what we will be also the case in the rest of our specialty. But when we look at it 6 years ago, the conclusion were only 10% of the articles that were published in this field were they reported challenges associated to the use of AI in during the development or the perspective related to this research. So it was the starting point, and we said, okay, let's have more deep investigation about challenge, and maybe we can look at the radiological field because they have couple of experience from decades. So I wanted to share this article because it was one of the most relevant and impactful in the community of radiology, because they asked this question about the implementation of AI in radiology and all the questions related to the sustainability, environmentally, economically, and also related to the social dimension. And you will see it's one of the only one article that also share a couple of data around this question. And it's complex to obtain good data all around these questions. So for radiologists, they start to compare the carbon dioxide released by a human compared to a car or a CT or MRI. And so, as you can see, yeah, there is already a huge release of carbon dioxide. But if you want to compare a traditional device with the implementation of AI, if we look about OpenAI ChatGPT 3.5, we already have a huge impact of the training of this technology. And OpenAI is not the most AI tool that released the most of carbon dioxide. When we try to compare to the old technology that were compared, more and more you train your AI, more and more you release your carbon dioxide. And so here you can see a figure that try to synthesize the most recent one. But I just want to say, okay, be careful with this data. There is not so simple to obtain data related to this question. So, but this article is one of the most relevant related to the question. So I would just say, be careful. Probably it's not 100% accurate, but it's one capture of this question. But one key point is, okay, here are only the data for training. If you want to have any idea of how much it's for the training and inference, it means when you will use this AI in the real world, the authors estimate that it's probably 1,000 times more than the value for only training. So it means it's a huge amount of carbon dioxide. So there is question related to the sustainability of all these devices. So after this starting point, the author suggests to identify 4 key challenges related to the implementation of AI, regarding the energy consumption, regarding the data center emission of carbon dioxide that are going to be more and more important, the use of water that is already huge and will going more and more. They estimate that in 2027 it will be close to the more than the, for example, the Denmark country, but also one challenge related to the waste and specifically to the hardware that is limited in terms of life, and also regarding the rare elements that are useful for AI tools and that will be limited in the future. So what about dentistry? Just quickly, when we talk about the question of sustainability of dentistry, there is a couple of good articles about that, but curiously, we were not able to find anything about sustainability of AI in dentistry. People are on one side on AI, on the other side on the question of sustainability, but nobody is working about the sustainability of AI in the field of dentistry. So that's why, and it was really close to the conclusion that we had 5 years ago, because when we look about all the challenges that were emulated by the community of dentistry related to the implementation of AI, people talking about how you have to be to be careful about equity, privacy, responsibility, but nobody is talking about sustainable development. We were notable about more than 200 articles. Nobody is talking about the sustainable impact of AI implementation in our community. So I will not explain all the sustainable developmental goal now, but all of these goals could impact our community, but the most probably the most relevant here are the number 3 and the number 13. And we try with Falk 3 years ago to look at how these 17 developmental goals will be impacted by the implementation of AI. So we try on this way. We selected the goals that are the most impacted by potentially by AI, and we try to split in 2 ways. On one side, we try to see how AI could could help to enable SDGs as Sustainable Developmental Goals. So here you have a list. It will help to improve organization. It could help to promote health surveillance, promoting education and access, fostering governance, advocating standard and promoting transparency. But on the other side, for each of these SDGs, implementation of AI could also have negative impacts. And so that's why there are the point that we have to be careful about it. It's about, for example, the risk of bias, the problem regarding the regulation and law, the cost that create inequality, the resource consumption, and, for example, the problematic related to the organization. If you want all the detail, you can go back to this article. But the point and the conclusion of this article was, okay, we have to be careful. AI, it's a nice opportunity, but there is a double-edged relationship between AI and SDGs, and specifically in the field of dentistry. So we have to be careful of these 2 parts, not only the one that we want to look at it, but on the 2 parts of the impact. So when we go back to the radiology, because they already think about what could be done in the future, I would like to share 2 things. They have couple of suggestions to improve and strategic decision that we could help to promote more sustainable AI implementation. So regarding the selection of model, the design and the sustainability of the hardware that are used, the way that we could think about the data center, the data management, how we can create a circular and economy and recycling. Yeah, there is a couple of suggestions, and you will see at the end of this presentation, Falk will make specific proposition for the field of dentistry. But one that I would like to share is this one, is also to think about how we can inform the future user. I mean, we can have this discussion between all the specialists and the researcher, but we also have to think about how patients and our practitioner could be aware about the quality of the AI that is proposed. And here it was a proposition in the same article. They suggest like such kind of eco-label of the AI tool regarding its sustainability regarding different parameters. So here it was specifically for radiology, but probably tomorrow we can think about this type of label regarding the field of dentistry. So now it's time for the field of dentistry, how we can work about more sustainable dentistry. Falk?
Yes, thank you. Yes, what we try to do is, and maybe you can click forward a little bit so that the slides start. What we try to do in a very recent article is to think about the specific problems. Why is it so hard to address sustainability in dentistry in AI? What are potential targets? which points could we potentially address in the future to not only have the benefits of AI, and I think I made very clear in my first part that I see a lot of benefits also when I think about better diagnostics, about teledentistry and accessibility, more fairness in accessing dental services, these services maybe getting cheaper and so on. So there are various things, not only the quality itself, but also beyond that where AI could help us. But on the other hand, we saw these sustainability issues in radiology, and they all apply to dentistry as well. And in our point of view, this has partly as a reason that our field is quite fragmented when we look at different users, different tasks, and different context, which makes AI in dentistry particularly complex because at the end, dentistry with all its subdisciplines is a little bit like a small medicine, where you also have different users in the different medical fields. Each user in each field has different tasks and context and so on. And we have the same whole microcosm, but condensed in our profession of dentistry. And I want to go stepwise through these different users. Click, please. And tasks and context. And you all know these users, for instances. It's the clinicians, it's the admin staff at the front desk, it's industry, and it's us as researchers and educators, but it's also professional bodies and regulators, as well as our patients. All these are potential consumers of AI, and because they have different demands and different goals with what they want to do with AI, it's very hard to suggest unified solutions for the sustainability problems, because from a clinician's perspective, very different priorities to AI and its sustainability, but also performance, apply in comparison with maybe a patient or a regulator. So that's the first problem we are facing. Click, please. And you can see this here summarized, that some examples, and we will go through the potential solutions for these challenges. Some examples for the challenges are shown here when it comes to the first dimension, which we identified, which is the users. First, it's the heterogeneity. No, please go back. It's the heterogeneity. Secondly, it's the limited preparedness, maybe not necessarily of our patients. I think for the patients, it differs who you look at. The young generations of patients, they are very willing to use AI tools. But especially with the clinicians, the larger proportion, and we have survey data on that in many countries, particularly high-income countries globally, like, let's say, Germany, where I'm from, or France, but also the US and the UK. These countries show a very limited AI preparedness in healthcare because healthcare professionals are not used to use these tools. The AI openness in other fields is far bigger than in healthcare because we have a highly regulated, very rigid healthcare system in many of these high-income countries. Data looks very different for low-income countries where, due to the dynamics which you have anyway in developing these healthcare systems, there's a bigger openness and hopefully also a higher preparedness for AI in the hands of clinicians. And the third aspect, which we'll try to address in a second, is that we oftentimes don't include patients when we develop these AI tools. I'm not aware that manufacturers developing, for instance, this image analysis tools in dentistry are including patients in what they want to do. They include the users, which are the clinicians, in what they want to do. And so at the end, you end up with very different goals. You have a very clinician-centered AI system, which may even open up that gap in sustainability when it comes to patient-centered or society-centered outcomes. Next slide. When we look at the tasks, we have a range of tasks. As I said, we are a whole microcosm. We have the more diagnostics and decision-focused tasks. We have the admin, the communication and so on tasks in the front desk. We have maybe education and research as a third complex. And of course, we have the whole CAD/CAM workflow, so moving away from diagnostics into treatment and treatment support. And all of this comes with very different goals. Manufacturers have very different goals when they want to fulfill these different tasks and very different priorities. Next slide, please. And just to give you two examples, and we will come to the solutions in a second again, when it comes to the task, we saw the challenges of the fragmentation, which I displayed to you, but also the misalignment in what these tools are supposed to do in the hands of the manufacturer/clinician. I give you an example. Let's look back at this caries detection tool. What is it doing? Well, it's pushing a lot our sensitivity, which is fantastic from a clinical side and probably a huge argument from a manufacturer side. But if the clinician now sees more caries and treats it in an invasive way, we have tons of data that this is bad because we are basically incentivizing and facilitating overtreatment, invasive overtreatment, not at all in line with the goals of minimal invasive dentistry. So these different perspectives, they need to be brought together. We need to think about the different priorities when we develop these tools because they may not necessarily align with that of sustainable care. Next slide, please. And then we have the context. And again, this is very complex in dentistry because we have the clinical context, the technological context. I think these two are rather well aligned because oftentimes tech companies, they have clinical people like dentists in their teams, but they usually don't have an ethicist in their teams when they develop an AI. They don't have an educational person who thinks about what does this mean if I implement an AI tool for radiology analysis in a university? What's the challenges? What's the aspects I need to think about and prioritize? What does it mean about de-skilling in the long run, which is also a sustainability problem? And they also don't care too much about the societal aspects, the culture aspects, and the economic aspects. And to be frank, it's not even their task to think about this. This is the task of other people. So we need to think about these different settings and contexts and viewpoints far more in the future when we want to address sustainability than what we are doing now. Next slide, please. And just to give you again 3-4 examples of what kind of challenges Maxime and I thought about is we have regulatory systems, and I mentioned ISO before, lagging behind. We now have the first ISO standard, 18374. Come and buy it at ISO and read it. I really encourage you. It's a joke that you need to buy it. I can't give it to you for free, but that's an ISO problem. But it's the first ISO standard in the world on AI in dentistry. And it's so far also the only standard internationally on AI in dentistry. And that, considering that we have this technology for more than 5 years now in our field, that's crazy. The second aspect is we have an inequality and inequity in accessing digital infrastructure in AI, affordability of AI, but also the platforms it's running on, the digital environment and the practice are a problem. We have fragmented and siloed data systems, so we need to think more about interoperability. And we also need to think more when we develop these tools about the ethical problems like informed consent, like transparency, like accountability, where, however, we are seeing more and more regulatory and governance emerging. And I just want to mention the EU AI Act. Next slide, please. So if we look about the strategic opportunities, I don't want to read them out here for you. I just will mention them very briefly. There are tons of them. We can think about more co-creation with diverse groups. We have to embed ethical aspects. We have to think about sustainability, education, and research aspects. And we should involve patients. And I think this is something which we have learned over the past, also when we think about, for example, research agendas and developing various research strategies. We should always think about patients and their perspectives. And we're doing this more and more in medicine, and dentistry should also do this. When we look at the green bar, the task there, we would encourage interoperable modular architectures with open benchmarks, maybe even open data sets being involved, open protocols, because that allows us to really understand the technology better, to scrutinize it better. And that's why at our WHO group, AI for Health, we are actively trying to develop benchmarking infrastructures to really allow comparison of these different tools for different regions and different image characteristics. And we should also push more for AI, not just, I'm not saying just, but to not focus necessarily only on interventions which are currently well paid and profitable in dental practice, because this is where AI went. And I even understand that. We developed a tool which goes into a similar direction in detection and treatment support. We should think about AI for prevention, for behavior guidance, for maybe even public health and epidemiology more in dentistry. That's probably not something we can necessarily do with industry in all cases. We probably need to think about other funding sources, but we should do it. And lastly, if we talk about the context, we would like to suggest a small-scale regulatory sandbox approach where we test these approaches and see if they work to enable real-world pilots and where we test these systems and the frameworks. We need cloud-based, low-cost environments if we want to tackle inequality and access. I think that will be, to be honest, the least of our problems because everybody is going there anyway. We are actively developing and pushing for federated learning where we try to open up data sets and if you mirror this in federated infrastructures and maybe also open infrastructures and platforms for AI, I think that can also help us, and we should push for interoperability more. And finally, all of you are more than encouraged to work at ISO or to work in our WHO initiative. And I saw some names here on the right-hand side already who even do so already, to work on data governance, to work on standardization, and to work on ethical frameworks. And with that, I give it back to Maxime for the conclusion.
Thank you. So last slide, just to have three small take-home message. The idea is to think that AI will have an impact to our in our community, and the sustainability of this new device, this new technology, should be always managed and analyzed regarding to the SDGs and specifically to the number 3 and number 13. We need, as a community, to establish a couple of ethical and regulatory standards to be able to, to promote a good use of this device. And we also have to integrate and to promote responsible use and development of tools that will consider reduce energy consumption, and that will be able to manage all the wastes that will be produced by the implementation of this tool. And hopefully, and it's my and I think our vision with Falk is AI is not just a tool, it could be also a way to structure and organize our community, not only at an individual level, but include as a community, but also as a community of dentistry inside the society and in our planet. So we strongly believe that AI could help to make stronger link between and stronger interaction between all these different levels. And hopefully, if everything go in the good direction, I think it will help to raise something nice.